Hello, my name is Pharand, and today I'll be demonstrating the insertion and the removal of a Foley catheter. So to start off, we're going to take a look at our physician's orders. So we're going to look at our patient's name, Jake Nursing, and the date of birth, January 1st, 1960. And now we're going to look at the new orders. So for today, February 7th, 2021, at 07:36, we have an order to insert Foley catheter now to monitor fluid balances, intakes, and outputs closely. So we can see that it has been transcribed or signed and as well as reviewed. So the physician's orders are good, and once we have reviewed those, we will gather everything we need. We'll gather our supplies as well as wash our hands and make sure pericare is done. In this case, we have already done pericare. So we're going to set aside our physician's order sheet, and we are going to grab all the supplies that we will need for the procedure. And so in this case, once we have all our supplies that you would get from your supplies room in your facility, we are good to enter the patient's room as we make sure we have washed our hands before this procedure. So we're going to enter the room and we're going to do a quick safety check, make sure that everything is safe and there's no hazards, and there's not. So the first thing I'm going to do is going to be introducing myself. So I'm going to say, hello, my name is Cameron. I'm a student nurse from the University of Manitoba today, and then ask if it's all right if I see their armband. So I'm going to look at their name on their armband here, Jake Nursing, as well as their date of birth, January 1st, 1960. And once I check that, I'm going to ask them if they could verbally state their name and their birthday to me. So they're going to say Jake Nursing and their birthday, January 1st, 1960. And once they state that to me, I'm going to explain to them the procedure that we're doing. So today, Jake, we're going to be inserting a Foley catheter, which is a sterile tube that will enter up your urethra into your bladder, as the physician requests that we monitor your output. So we will need to insert this Foley catheter. We will also be injecting 10 milliliters of sterile water into a balloon at the end of the catheter inside your bladder, just so that the catheter doesn't slide out and it's stable in place. So then once that is in, we are able to drain the urine into a bag where we can monitor it. So if that's okay, if we can we proceed with the procedure? And the patient's going to say, yes, you're okay to proceed with the procedure. So I'm going to start off by grabbing my drainage bag here. And now with this procedure, I'm going to make sure that I raise the bed as well as the table I'm working on up to my waist height to maintain sterility over my waist. In this demonstration, we only have a table that does not move. So I will be performing at this level here, keeping in mind that in a clinical situation, I would raise everything to my waist level. So the first thing I'm going to do is I'm going to grab my drainage bag, and I'm going to connect this big bag to a non-movable spot on the bed that's not going to be able to move, as well as I will attach this end somewhere near where I'm working, probably to a bed sheet somewhere right around me, just so I have easy access to it when I need it later in the procedure. However, right now we have nowhere to clip it to on this table, so for this demonstration, I'm just going to leave it up on the table here until we need it. So now that we have got that out of the way and we've explained the procedure and they're good to, and the patient is good to go with it, we can go ahead and expose them. So we're going to expose them here, and then we can start right away on our sterile field. So noting to maintain sterility of only grabbing in the 1-inch border of the sterile field, we're going to open it, not touching anywhere in the inside the 1-inch border. So once our sterile field is open, we can go ahead and start right away and grab our garbage bag out, and then place our forceps down. So we can grab our garbage bag here, and we'll set it up upon the side here. And now that we have that set up, we can go ahead and grab our first drape here. So we'll grab our drape, and this again as well, we'll only grab in the 1-inch borders or the corners. So we're going to grab the corners of this drape and place it right in front of the patient here. And this is a male, so they'll be we'll be abducting the legs slightly. And then once we have placed that drape down, we'll grab our fenestrated drape, and as well grab the corners of this drape too. And once we have grabbed the corners of this drape, we will insert it just over the penile area of the patient, so their genitalia is exposed and we can work with it. And then once that is placed, we can go ahead and grab our catheter. So we would grab our catheter, and maintaining sterility as the blue package inside is sterile, we will be opening our catheter, I'm grabbing our blue forceps, and we will be grabbing the catheter itself and pulling it out and placing it into our boat. So once that is placed into our boat, we can set aside our forceps and throw this right in the garbage. So we can throw that right in the garbage, and then once that has been thrown out, we can go ahead and start donning our sterile gloves. So we are going to grab our sterile gloves out here, maintaining the sterility of these. Same with our working space here. We can only touch the 1-inch border of this area. So we're going to open our gloves here, only touching the outside 1-inch border. We're going to spread them wide open, and once it is spread wide open, we're going to start by donning our right hand glove. So I'm going to grab the glove and place my hand inside. And once this glove has been put on, we can go ahead and grab our second glove. And then now we can adjust, since it's sterile to sterile, we're able to adjust any imperfections in our gloves. So now we can grab our sheet here and just throw that aside as well. So now we are working in our space, and we're able to touch everything inside of here because our gloves are sterile. So we can grab our catheter here and pull this out, and we can throw this away, and we can put our catheter inside of our boat. So once this is inside, then we'll grab our povidone sticks inside, and we'll open them and get them ready for later use. And so now that we have that ready, we will also be attaching our 10 ml syringe to our catheter. So we can uncap it here and just throw out this cap. And then we'll be inserting it into the port of the catheter. So we will be inserting it in here. And now that that's inserted, we can grab our lubricating gel. And for this, since it's a male, we'll be lubricating about 6 to 8 inches of the end of the catheter. So we'll be lubricating all down the catheter on all sides. So yeah, we'll be lubricating about 6 to 8 inches there. And once that's well lubricated, we can throw this out, and we can place this back in our boat. At this point now, we can move our sterile field onto our other field in between the patient's legs. So I'm going to move this right near the patient so we have more access to work. So now that we are over here and ready to go, I am going to start by cleaning the penile area. So I'm going to grab the shaft of the penis with my non-dominant hand. And once I've grabbed this, I'm going to grab the povidone sticks with my other hand, which is considered still sterile. And I'm going to start cleaning. Now I'm going to start at the meatus and work up down the glands to the base of the glands in a circular motion. So I'm going to work up, and then I'm going to throw out the povidone sticks. So I'm going to do a second one here. Again, starting from the meatus, working our way around. And we're going to do one more, we're going to do a third. And there we go. So now we can throw out our package as well. And so now that everything is thrown out, we are ready to insert the catheter. So we're going to grab the lubed up catheter here, and we're going to insert it into the patient. Now we're going to tell the patient to bear down and take some deep breaths as we insert it. So we are going to go in the penis. We're going to go up about 6 to 8 inches. So we're going to say that that's about 6 to 8 inches, and we see urine coming out now. So that means we are just touching the bladder. So we'll go about 1 inch or 2 inches more inside so that we can assure that we are in the bladder. And once we are sure that we are in the bladder and urine is flowing out, we can let go of the penis and stabilize the actual catheter as we inject 10 milliliters of sterile water into the balloon at the end. So we're going to slowly inject this as we're stabilizing the catheter. And once all the sterile water has been fully injected, we can remove our our syringe, and we can instantly discard this. And so urine will be flowing out of here, so we're going to keep it in our sterile boat here. And then once that is emptying out, we can go ahead and grab our drainage bag. So we're going to grab this drainage bag here, and we're going to again clip this to a non-movable spot on the bed. And then once that is connected to a non-movable spot, we'll uncap our sterile tip here, maintaining the sterility under the cap. So this is considered sterile. So we will be throwing that in the garbage, and we will be connecting the two together. So once those are well connected, we will then attach this to the side of the patient's leg here, making sure that they have enough room as well so that they can move around a little bit. And then it's going to be attached to the side of the patient's leg, and we can go ahead and remove this. Now that it is completed like that, we're going to perform pericare. And once the pericare is done, we're going to clean up the patient here, and we're going to clean up our supplies. We're going to wash our hands. We're going to take off our gloves. We're going to wash our hands, and then we are going to do a quick exit safety check. We're going to look around, make sure there's no concerns. I'm going to lower the bed again down to a safe level. Make sure they're safe and comfortable with the call light in place. And then after that, I'm going to finish and go document. So when I'm going to the chart to go document, I'm going to document that I inserted a 14 French Foley catheter to monitor, as the physician requested, to monitor the outputs. I inserted with sterile technique. I inserted 10 milliliters of sterile water to inflate the balloon. At the end, it was easy to insert. The patient tolerated it very well. I got it on the first try, and 500 milliliters, we're gonna say, was exited out the body into our boat. So we collected 500 milliliters of clear amber colored urine that had no odor, and I will now initiate an input and output record, and that is the conclusion of the insertion part of the catheter. So now we can go ahead and get rid of this. So now on a different day, you would receive your new orders. You would come look at your physician's orders, and you would see that you have now a order for today to take out the Foley catheter now, as the intakes and outputs do not need to be monitored closely anymore for this patient. So again, in this case, you would go grab your supplies. So in this case, we would go grab our syringe here. We'd grab a new syringe, as well as we would grab a absorbent pad to go under the patient. We would wash our hands. We would make sure pericare is performed, and we're going to say that pericare was already performed. We would, after we wash our hands, we will enter the patient's room with our supplies, and we're going to enter and we're going to do a safety check around the room. We're going to make sure that everything is in place and there's no hazards around the room. And once we've figured out that there are no hazards, we're going to head to straight away look at the or introduce ourselves. We're going to say that I'm going to say that my name is Cameron. I'm a student nurse from the University of Manitoba, and then I'm going to ask if I can check their armband really quick. So I'm going to look at their armband. So I'm going to look at nursing Jake, or Jake Nursing, and their date of birth, January 1st, 1960, January 1st, 1960, again, as compared with the physician's orders. So then we're going to, once we have compared that, I'm going to verbally ask the patient if they could state their name and date of birth for me, and once they have stated their name, Jake Nursing, and their date of birth, January 1st, 1960, then we can go ahead with the explanation of the process. So we are going to explain that we'll be removing the catheter today because the physician no longer requires that we are monitoring their outputs very closely, so we can remove the catheter, and they're going to tell us that, yeah, we can go ahead with the procedure. And so once we are good to go ahead with the procedure, we're going to wash our hands and apply new clean gloves on and make sure that, yeah, pericare is done. And so now we're going to go ahead and grab the drainage bag, and we're going to empty it. We're going to grab the drainage bag and we're going to empty it, and in this case we're going to empty 300 milliliters of clear amber urine. And once that has been emptied and we have got that, then we're ready to take out the Foley catheter. So now in this process, we're going to start off, we're going to grab our syringe, and we're going to attach it into the port for the syringe here. And once that is attached, we're going to pull out the 10 milliliters of water, sterile water. And once the 10 milliliters of sterile water have all been pulled out, we can go ahead and deconnect our syringe and throw this directly in the garbage. And then now that that's in the garbage, we can go ahead and tell the patient to take some deep breaths and bear down as we gently pull out the catheter. So we're going to say, all right, kid, take a couple deep breaths as you bear down as we pull out the catheter. And then the catheter is now out, and we can go ahead and check the tip of it, and we will see that there is no blood and it is fully intact. So we are good to go there, and then we can go ahead and throw this whole system out, as well as with our gloves. We would take off our gloves and throw it, and then wash our hands, as well as we would complete a final pericare. And then we would clean up the patient's bedside. And once that has been completed, we will do our exit safety check. So I will lower the bed and to a patient in a safe, comfortable position. And once they are in a safe, comfortable position with no hazards around and the call light is in, then I will go document. And for documenting for the removal of my catheter, I will document that I removed a 14 French catheter, as well as I removed the 10 milliliters of sterile water, and the tip was intact with no blood, and so it was easy to remove. The patient tolerated the procedure very well, and that the patient is due to void in 8 hours, and that is the completion of the removal part.